At this point, it's just trying to strengthen the core muscles around the area and keep doing the exercise that they're telling me I need to do.
The rehabilitation part of it is huge. That's why the physical therapists, the trainers, they just play a vital role in the surgical results.
When I come out of there, I'm sore, I'm hurting, but you got to give 100% because if you don't, you're not going to feel better.
For a fusion, I don't start physical therapy until easily 2 to 3 months after surgery.
So there's initial phase coming out of surgery that we're going to be managing pain. We're going to be managing basic limitations of daily activity and a slow introduction into exercises that are tolerated by each individual.
The first thing you learn about back problems is that your back problem is not in your back, it's in your core. So it's all exercises that have to do with strengthening your core, strengthening your legs, and things like that.
Second phase of that post-operative phase is going to be introducing increased level of exercise. It's going to be showing a higher level of function, from doing basic activities in the house to maybe doing some very light activities and performing a routine that they can manage on their own.
I had a wonderful physical therapist who I trusted enormously. She moved away and I was very upset about it. I tried another person who hurt me so badly in 3 sessions that I had to leave and get an epidural. Terrible, terrible experience.
And I think sometimes physical therapy might be detrimental. If you got this overzealous patient or maybe overzealous physical therapist and trying to get this patient to get stronger, they create more inflammation, which irritates the nerves and just slows down the process.
After the first surgery, I went to what I'll call a mill, where nobody knew me and nobody paid attention. They wrote down what I was supposed to do and I did it. It was not helpful.
Right now I'm with somebody who was recommended to me by my doctor, and she's been incredibly thoughtful about what I've been through and hasn't hurt me at all, has worked very slowly on helping me regain my strength.
I was looked at, I was touched, I was talked to, and they were very helpful in explaining what the therapy was and how I needed to change everything I do.
I would go through the first couple of physical therapy sessions, and as I'm doing them, I'm sort of thinking, well, I could do this. And you're about halfway through it and you realize that you are drenched in sweat and you're dead tired.
I can treat somebody and get them better after a surgery without needing a lot of back movement. I want my patients' legs to get stronger. I want their back mechanics to be solid. They need to be able to roll up and out of bed. They need to be able to relieve the postural stress that they experience anytime through the day.
I was on my back on the training bed the whole time, and it was just a lot of stretching and moving of the legs and kind of realigning, getting the shoulders back open up and getting the spine back in order.
Our final stages of post-operative rehab are going to introduce the activities that are consistent with that patient's goals.
And then after a month, they kind of had me up and doing some agility exercises and some strengthening exercises. 3 months after surgery was when I kind of felt I turned the corner.
It was this slow getting better and better and better, and it started happening faster and faster and faster.
I did physical therapy for about 4 months, I think, and every month I felt like there was a difference. And it was really just working on my core, strengthening my core, but I felt stronger kind of all around. Each month I noticed it.
And sometimes all you need to do is say, we just need to succeed with one thing. Once a patient starts seeing small successes, then you can start building on those small successes.
If you can't commit yourself to doing the physical therapy, don't do the surgery. Because I think this physical therapy is more important than the surgery.
I'm still trying to do it at home just to keep it going. I have a friend who had the same surgery and he ended up having it again with a different disc later, so he's like, stay on your core.